Good day, everyone. Today I will be presenting on the dual burden of communicable and non-communicable disease in lower middle income countries with a focus on how universal health cover, the sustainable development goal, and the One Health approach can be integrated to strengthen health system. This presentation means the challenges faced by lower middle income countries and propose strategies to improve health equity and system resilience. Lower middle income countries face what is known as the dual burden of disease, where communicable disease such as dengue and tuberculosis continue to persist while non-communicable disease like diabetes and cardiovascular disease are rapidly increasing. The situation is made worse by poverty, urbanization, climate change, and unequal access to healthcare. The objectives of this presentation are to analyze the global health challenge, evaluate how universal health coverage, the Sustainable Development Goal, and the One Health approach can address them and recommended strategy for stronger and more resilient health system. The dual burden occurs when infectious and chronic disease coexist within the same population. Rapid urbanization, population aging, unhealthy lifestyle, and ongoing infectious disease outbreak all contribute of this challenge. Health systems in many lower middle income countries often have limited resources, making it difficult to respond effectively to both disease groups. As a result, healthcare delivery becomes fragmented and vulnerable population experiences greater health inequalities. Communicable disease such as dengue and tuberculosis remain major concerns because of climate change, poor sanitation, overcrowding, and weak disease surveillance system. At the same time, non-communicable disease continue to rise due to unhealthy diets, physical inactivity, tobacco use, and aging population. Together, these diseases increase healthcare costs, reduce workforce productivity, and place tremendous pressure on already limited healthcare resources. Health outcomes are strongly influenced by social, economic, and environmental determinants. Social factors such as poverty, lower education, poor housing, and living in rural areas reduce access to healthcare. Economic factors, including income inequality and inadequate healthcare funding, delay diagnosis and treatment. Environment issues such as climate change, air population, poor water quality, and extreme weather even also increase disease risk. Addressing these underlying determinants is essential for improving population health. The dual burden places enormous strain on the healthcare system. Hospital and primary care services become overloaded, while governments struggling to allocate limited resources between infectious disease control and long-term management of chronic illness. Healthcare expenditure increase, vulnerable population experience poor access to service, and healthcare inequities continue to widen. Ultimately, these challenge threaten sustainable development and economic growth. University Universal health coverage aims to ensure that everyone can access quality health services without experiencing financial hardship. Strongly, primary healthcare plays a vital role in early detection, prevention, and continuous management of both communicable and non-communicable disease. However, many lower middle income countries still face significant barriers, including limited healthcare funding, shortage of trained healthcare workers, unequal distribution of services, and inadequate infrastructure. The Sustainable Development Goal provide a broader framework for improving health by addressing its root cause. SDG 3 focuses directly on health, while goals related to poverty, education, sanitation, inequality, and climate action all contribute to better health outcomes. Achieving this goal requires collaboration across multiple sectors beyond healthcare, including education, housing, agriculture, and environmental management. This integrated approach support long-term improvement in population healthcare. The One Health approach recognizes that human health in closely connect with animal health and the environment. Many infectious diseases emerge from interaction between people, animals, and ecosystem. By strengthening collaboration between medical, um, veterinary and environmental sector, one help improve disease surveillance, outbreak preparedness, and respond to climate-related health treat, threats. However, successfully implementation depend on strong coordination across different government sector and stakeholder. The most effective approach is to integrate universal health coverage, the Sustainable Development Goal, and One Health into a single strategy. Uh, Universal health coverage improve equitable access to healthcare and financial protection. The Sustainable Development Goals address the social, economic, and environmental factors that influence health. One Health strengthens surveillance and prevent emerging infectious disease. Together, this framework creates stronger, more resilient health system, reduce health inequalities, and improve long-term population health. Based on this analysis, I recommended five key actions. First, strengthen primary healthcare and integrate services for communicable and non-communicable disease. Second, expanded digital health technology and telemedicine to improve access in rural communities. Third, invest the climate resilience on One Health surveillance system. Fourth, address the social determinants of health through multi-sector policy. Finally, improve healthcare financing while ensuring a more equitable distribution of the healthcare workforce across urban and rural areas. For my conclusion, the dual burden of communicable and non-communicable disease represent one of the greatest public health challenges facing lower middle income countries. Social, economic, and environmental determinants continue to drive health inequalities. universal health coverage, the Sustainable Development Goals, and One Health framework each address different aspects of this challenge, but together they provide a comprehensive solution. Through integrated multi-sectoral action, countries can achieve more equitable, sustainable, and resilient health system. For this, thank you for today.